First of all, I would like to say thank you for the opportunity to speak to you all today. Everyone has made several excellent points, and the most important thing to remember is the focus of providing quality health care for citizens across the board, which everyone agrees on. One point that is highest on my list to mention is the entire premise of the Affordable Care Act, and that is affordability. As a nurse, I believe that I accurately represent middle-class America. The Affordable Care Act makes several improvements for people who were previously unable to afford health care. However, it increases costs for citizens like myself. I understand the argument about higher quality care, but I agree with Representative Charles Bustani that this falls on deaf ears when you start reaching into the pockets of Americans who are already strapped with expensive health care costs and they're bitter about it. Adding government regulations that will increase premiums are only going to add to the already existing disdain. I believe there has to be a way to improve quality of care without further increasing costs. As a nurse, I frequently see people's frustration when the health care plan they pay for out of pocket every paycheck denies coverage of a medically necessary procedure as determined by their primary care provider. These private insurance companies pay doctors to determine medical necessity of procedures, medications, and hospital stays. In my opinion, this is a conflict of interest, as this company wants to reduce costs and therefore wants doctors to find reasons not to pay or to determine that these things are not medically necessary. Government regulation and monitoring of these private sectors would help control costs and ensure that patients are getting quality care. According to a recent article in the Washington Post, one way of doing this is an independent payment advisory board. I agree with Senator Tom Coburn that there should be an incentive and emphasis on preventative care, and there's an extensive arena for cutting costs. There is also an area where using nurse practitioners as primary care providers could be encouraged, as they have proven to be competent and efficient providers at a fraction of the cost. One other example is revamping the food stamp program, as Senator Coburn also mentioned. Our government-funded food stamp assistance is contributing to the rising number of diabetes and heart disease patients in this country. If this is a service we choose to provide as a country, it should be one that contributes to the wellness of its citizens and not the illness of its citizens. One last thing I would like to mention is combating fraud, and as already has been mentioned, this automatically puts money back into the budget. According to the Pew Charitable Trust, the Affordable Care Act is strengthening provisions against this. Under new CMS regulations, states are required to terminate Medicaid providers whose Medicare billing privileges have been revoked by the federal government or who have been terminated for cause by another state. The agency has launched a web-based application that is meant to facilitate states' efforts to share such information. These are the sorts of steps in the right direction that elected officials should be focusing on. Thank you again for the opportunity to speak, and thank you for your service and your commitment to the American people.